tell our viewers a little bit about yourself, because you are mysterious, but also well known.
All right, well, that's an interesting commentary. So I'm a cardiac surgeon by training and profession, been doing that for close to about 30 years. We came from Sunnybrook Hospital, started the heart surgery program here in Mississauga about 18 years ago. I was head of the cardiac surgery program and then chief of the medical staff for a number of years. But wanted to return, loved medical administration, but we grew the hospital. The hospital's big, they needed a full-time, chief administrator. And I just love surgery. So I returned to my surgery, and that's what I've been doing, for the last 5 years, is just full-time cardiac surgery, which I tremendously enjoy.
So with regard to then, say, the, hierarchy of kick-ass surgeons, you're up at the top.
Never, like my mother said, you never talk about yourself, but I've been humbled by the respect that I've been given from patients and my colleagues, absolutely. So, we endeavor to just do a good job for everybody.
So, as somebody obviously who works with people at the direst stage of their health needs, and one of them being heart, and we all know that smoking plays such a huge role in heart disease.
There's no question that the patients, and that again gets back to why I got interested in vaping, which we'll talk about. But there's no question that smoking, tobacco-related illness, cardiovascular disease is one of the leading causes of stroke. Heart attacks, in addition to the emphysema and the lung cancers. It's implicated in prostate cancer and throat cancer. So, it's just burning tobacco leaves are toxic to your body.
So, what's your position then as a medical doctor on vaping?
Well, before I actually got into the business of vaping, I spent about 6 months, and this is going back close to about 4.5 years ago, going through the science. Because for me to involve myself in anything, it had to pass my ethical test that I was doing no harm, and I saw the potential that this is an alternative to tobacco, and that's how my now friends and business partners came to me, because I actually knew nothing about vaping. But I've always considered myself a bit of an innovative, open-minded physician and kind of an adventurous person. So I said, look, before I commit to anything, let me look at this, okay? Because the term electronic cigarette, when they said to me, I immediately says, I don't deal in tobacco, I don't deal in cigarettes. But they said, no, Gopal, this is totally different. Please take some time to look at it. And imagine 4.5 years ago, there wasn't a lot of evidence on it. But I looked at the basic science, looked at the chromatography science of vaping, because it's not a complex, as much as many people will tell you, well, we don't know what's in vape juice, we don't know what's in vapor. We actually do know a lot about it. I mean, it's a first-year undergraduate chemistry experiment to be able to do liquid chromatography and analysis of vaping, so there's no mystery about it. So the more and more I dug into it, the more and more I became intrigued as to why medical professionals and the medical community was not embracing this, because I saw, in fact, most of it 4.5 years ago was very antagonistic from public health and from medical societies. But when I talked to them, it was just a very knee-jerk reaction to it, because visually it looked like smoking, so it had to be smoking. And then it was hard to actually get a conversation going with regulatory bodies, with Heart and Stroke Foundation, with Cancer Care Ontario, and even my own medical regulatory bodies, like the CMA and OMA. They would just issue these statements that, well, it's harmful, it's a gateway, it's going to lure children into doing it, it's worse than smoking. And I'm saying, I'm just not seeing this evidence. So, ultimately I said, well, Gopal, put your money where your mouth is. If you think this is a good idea, then you've got to say it's a good idea, regardless of whatever, if it's the right thing to say, then, stick your neck out there and do it. Mm-hmm. So I became a proponent of vaping as an alternative to combustible tobacco use.
What was the push? May I ask? Yeah. What was the pushback from colleagues in the medical industry?
It's interesting. Individually, physicians were intrigued. Like in the hospital, they would ask me, Gopal, I hear you're running a vaping store. I mean, that stuff bad, isn't it? And I said, well, if you give me 2 minutes of your time, I'll tell you why it's not. And everybody that I ever talked to on an individual basis, physician to physician, when I actually educated them and said, and the science of it, they all said, yeah, it makes perfect sense to me. Why are we not hearing this? And then the more and more I dug into it, well, there's a lot, tobacco is a big money industry. It's big money for governments. It's big money for people that sell products about smoking cessation, from pharma to other types of products. Anti-smoking campaigns are a big big shiny fundraising opportunity for a lot of different organizations.
What is the 2 minute kind of
Yeah.
convincing
Well,
for vaping?
number one, I tell them it's not a tobacco product. Okay, the only reason the regulatory industry calls it a tobacco product is because they just don't have another category to put it in. It's purely a bureaucratic thing. Nicotine is either a drug, like was classified as either a drug made by pharmacy and you put on a patch or you chewed it, or it was in tobacco. So then, look, I don't blame anybody, but a regulatory body they've got two categories, and now they got a third thing. And they say, well, the easiest thing is to think, we don't know how to deal with this. So how do bureaucrats deal with things? They need to classify it. We need to have a class. So they just shove it in. And they said, well, it's not made by a drug company, so it can't be a pharma product. So it's a tobacco product. So by default, it became regulated and so the first thing was to convince doctors that, look, it's not a tobacco product. There's no tobacco in it. It's the same nicotine. We all know vaping can be done with or without nicotine, but it said if the ones that contain nicotine, it's the same nicotine that you would find in a patch or a gum. It's pharmaceutical. There's nothing evil about the vaping nicotine and nothing, purifying about the pharma nicotine. It's just a drug. It's just a chemical. So that was the number one thing, that it's not tobacco. And its main use is by smokers to try and get themselves off to reduce their use of combustibles.
And does it work?
Sure. So that's been, of course, the big controversy, right? So if you take a look at the published, you can go back to the original, one of the original papers, like the Lancet was done way back when, and it was about the same as nicotine and gum. But we take a look at those were the true disposable cigarette type of things. And we know that the nicotine delivery system in those was not as good. So even in the most primitive electronic cigarette product, because that's what they were at that time, when you compared it to the best medical therapy, it was at least as good. Okay, so if I'm taking it myself, look, if the e-cigarette is as good as nicotine patches or gums and replacement therapy, then why are you saying it's not a useful cessation model? Okay, you can't argue it both ways. So, public health would say, well, you got to stick to traditional, proven medical therapy. That's gum, patches, sprays, and then pharmaceuticals. But I kept on saying, well, yeah, but your studies are showing this is as good as this. So why the difference?
But so public health, though, from RegWatch's point of view,
Yeah.
we don't see public health playing a very vital role in terms of helping to promote vaping as a safer alternative to smoking. And that's a polite way to ask you.
No, that's
What do you think
very
of public
polite.
health?
That's very polite. So so it's interesting as you see public health, Britain public health, the Royal College of Surgeons, and just to remind your viewers that the Royal College of Surgeons of England was the first organization that actually called attention to the dangers of tobacco smoke, and then it was a decade later, before in North America we actually recognized medically that tobacco is dangerous. So it's a very prestigious, well thought out organization. They've got a huge publication. So on one hand of on the other side of the Atlantic, you've got public health that says, look, our number one goal of public health is to improve public health. Okay, and we're going to embrace something that improves public health. On the other side, the North American side, we've been obsessed by the risk side of it. Okay, that, well, until something has been absolutely proven beyond the shadow of a doubt, we can't support it. But what I think that paradigm then essentially puts a decade, 10 to 15 years of people at risk of disease because you're not willing to extrapolate the science. Okay, now again, I guess you could say you go back to the psychology of how large organizations run. If I'm working in a large public health organization, what individual advantage is it for me to stick my neck out and say, I'm going to take a chance and really get behind vaping because all the science makes sense? Because I stick my head out when nobody else is, I'm only at risk. I'm not really. So what I'm going to do, I'm going to be just a cog in the machine, and I'm just going to say this. Read from a pre-prepared statement is that until this point is proven, we can't endorse it. And then you've seen that over and over again. The same sort of automatons just talking. The talking heads just kind of spieling out the same old thing.
Public health is a big lobby.
So they have used, what we call their social capital, if you want to do that, and translate that into scientific capital. As well-meaning as they may well be, these are funding organizations. They raise money for research. So, when the president of one of these societies comes out and says whatever declaration they have about vaping, so I've asked them, well, by all means, this is your position. Who wrote this position? Can you introduce me to the scientists that have analyzed the data for you and come to this conclusion? No. Because this is where the heart and stroke, we are cancer care anywhere. We say it, so therefore it is true. It's like the pharaohs of Egypt.
So, it's arrogant, isn't it? Because people's lives are at stake.
Absolutely. In the absence of doing nothing, public health is doing harm. They can't be in a position to do nothing. Because just being silent on this is bad. Not doing your primary due diligence on it and then advising government on policy is even worse.
Public health, they treat vaping as a menace.
Sure, and it's totally counterproductive to what we know about vaping and what we know about the vaping community. The vaping community, by that I mean vapors, people that make vaping products, that whole community is a grassroots community that's really telling us that the medical paradigm for smoking cessation and has failed. And could be the biggest ally in the fight to eliminate combustible tobacco in our society. And yet public health and regulatory agencies don't realize that. They still function under this false premise that vaping is somehow a shadow lobby arm of tobacco. I will never blame the elected officials because all they can do is to process the quality of the information that they're given. And unfortunately, the quality of the information that they were given was misleading to be charitable.
So, but you're also saying, though, that the statements and positions heart, cancer, lung are putting out there are not even backed up by science as well.
They're not backed up by the science as far as I can read it. If they refuse to publish or refuse to tell me or the vaping community who are their scientists, who are their analysis, which papers are they looking at, So because if I don't know what science you're looking at, we can't have an intelligent discussion.
So we hear all the time that the science isn't in yet to be able to make the decisions, and then from what you're saying is that definitely the politicians are getting their concept of the science from heart, stroke, and lung, those associations, which are unelected, unaccountable. No way that vapors can have an effect on.
No, and remember, these organizations fund research. They're not a scientific think tank in themselves. So, it's not as if they're the Cochrane report or they're not a university professor. They sponsor the research, okay, but they're not a scientific think tank themselves.
So the final arbiter of what is allowed to be inhaled is not in the hands of government. It's in the hands of the private, public health.
In essence, because the regulators, vis-a-vis our elected officials, are going to take the best information.
Well, it's not just that. Social capital comes with social pressure.
Social pressure, and we already kind of discussed. There's no particular advantage to any of these organizations to take a novel or innovative view of things. You get back to your comment. It's that what burden of proof is required to make a decision. At this point, there are thousands of articles on vaping, on the chromatography, on the composition of vapor. Propylene glycol has been studied for decades. You probably remember the old thing, you're vaping antifreeze.
Right.
Okay, well, what people forget, though, and again, this is actively misleading the public, is saying, propylene glycol is an antifreeze. Why is it an antifreeze? Because it's non-toxic. Because ethylene glycol, when people drank antifreeze or dogs or pets drank antifreeze, they went blind, they died. You can take as much propylene glycol as you want. I could take a bottle of propylene glycol and I could chug it down it tastes slightly sweet and sickly, but it does nothing else to you.
I see, right. In the old days, antifreeze was killing you.
Yeah, it was killing.
Poison, and
Right.
they
So
changed it
now
up,
people,
and-
so see, that's the type of statement that actively misleads people because it's totally false. Yes, propylene glycol is an antifreeze, but it is there because it is safe. It's no longer toxic. The game right now has got to be to get people from combustible products to get off combustible products. Use and vaping by everything that you can read and is published, look at the science. Okay, forget about the morality. Vape. You look at the science of it. It is safer. And I'll categorically say it's safer. People say, well, how can you say that? And I said, well, look, it just is. All the science points to it. In fact, of all the years of vaping that has gone on, and thousands, if nothing else, it's been a massive uncontrolled social experiment. Okay, so if you take a look at it, I would defy anybody to show me any systematic disease that is caused by vaping. Okay, it's not.
Has there been enough time, I guess, is the
It's
question?
7 years, 8 years. Now, remember, it takes, after you quit smoking, it takes 10 years for your risk of, let's say, lung cancer to come to baseline. So vis-a-vis almost everybody that's vaped, or everybody that's vaping now, the overwhelming majority, we know that 94 to 96% of those have been smokers. Okay, and some continue to be dual users. So they still have the risk burden from their original habit, right? But if you take a look at vaping itself, people talk about, there was this big scare about lipoid pneumonia. Okay, so lipoid pneumonia, which is lipid fat, this kind of weird fat-induced pneumonia. Sure, that's all fine and well. That's a possibility. It was disproven. And number one, propylene glycol is not a fat. It's a carbohydrate. Okay, so lipoid pneumonia can't occur. There was other causes for this. Then they started taking about, batteries are exploding. Okay, well, that's a manufacturing issue. Lithium-ion batteries, the safety of lithium-ion batteries. We had cell phones exploding, but we didn't call for a blanket ban on cell phones. We said improve the technology so it's safe, right?
So, what's driving the kind of
It's just
the psychological kind of thing here?
Because as far as I'm concerned, it's almost become like a philosophy. It's become like a moral agenda that you should not put something in your mouth, inhale it, and exhale something. It's just almost this moral obsession with it. Okay, the same people have no issue though, but saying, if you need to inhale nicotine through an inhaler made by company X, that's perfectly fine. I'm sure those companies, when they, those organizations, when they say no inhaling, they don't mean, but a nicotine puffer is fine, of course, because that's going to be totally
made by
safe.
Pharmaceutical
It's
company.
going to be perfectly safe. So the idea, it becomes a moral, almost a zealot type moral stance. Say, look, step back. Our only interest has to be improve the health of people. Tobacco is the number one cause of preventable harm in our society. That's got to be the thing. Don't bring other things into it. All of a sudden, well, nicotine's addictive. It's interesting argument because nicotine's addictive. Okay, caffeine is addictive. Sugar is addictive, but nicotine, but yet. The organizations that say, well, nicotine's horribly addictive, have no problem still supporting the use of pharmaceutically produced nicotine patches, gums, and sprays. And what we see is that when you remove nicotine from combustible tobacco, its addiction profile is actually very limited. I don't see people addicted to nicotine patches, gums, and sprays that, they're lying in a corner. And that, yes, they get the nicotine cravings, but if we can support one use of nicotine, then why can't we support another perfectly legitimate use of nicotine that gives people, the full spectrum of the manual, ritual, okay, gives them the visual, psychological sensation of of smoking, and say because that's what they want. Who am I to tell somebody that's smoking that you can only use this? You can only use this. I'm not even telling them that you should only use vaping. Look, if you're smoking today, and you can just put away those packets of cigarettes, throw them in the garbage and never smoke again, do it. If you find that a patch or a gum or a spray works for you, do it. Okay? But many people, if it's not working for you, And if you just want to continue the experience, I mean, some people just do, right? Then there's nothing to indicate to me and to the community at large, the scientific community, that vaping is intrinsically dangerous.